Doctors of Reddit, what's the biggest case of faking it you've ever seen? Fourth year medical student. On my ER rotation, and a trauma came in from a woman that they had been arrested. During the drive, the patient banged her head 4 times against the window of the police car and then went unresponsive. She came to us with a bruise over her forehead and unresponsive. We all smelled BS, but the patient was a great actor, didn't even flinch during the digital rectal exam, which is standard for all patients that come in through the trauma bay. Though some of the nurses said that they caught her peeking at us when would leave the room. We ended up getting a CT scan, which was normal, and was even considering intubating her to secure her airway when our attending finally walked over to her, opened her eyelids and held them open while telling her to wake up. Finally she started fighting to close her eyes and the jig was up. The doctor called her out and she proceeded to start screaming at us. She was much more pleasant when she was pretending to have a brain injury. Years ago I had a patient who had been rear-ended in an auto accident a few weeks before I saw her. She had a history of lupus. She was decked out in the usual Lyme-crippled paraphernalia, crutches, neck brace, elbow braces, wrist braces, knee braces, and could barely walk. I saw her a couple of times and she showed no improvement. One Saturday I was on call but had to take a back streets route to the hospital because of an event taking place on the main thoroughfare. I apparently drove through her neighborhood, because, wonders behold, she was wearing old lady spandex power walking down the sidewalk, holding weights in both hands. I did not call out to her. Next week, she was back in clinic. With her "I'm crippled" get up on again. A few weeks later I got the subpoena for the deposition, and it all became clear. Not a doctor, but I'm a UK-based midwife. Had a patient who had been in and out of hospital throughout her pregnancy with episodes of heavy bleeding. This was her 6th baby, so she was a fairly well-known patient in our unit. The issue was no one had ever seen her actively bleeding. She'd call saying that she had bled down the toilet but flushed it, and all the examinations we did came back completely normal with mostly no evidence of any bleed whatsoever. On occasions during speculum examinations we'd see the smallest amount of blood. I was caring for her during a shift where she yet again called to say she was bleeding, walked into her room and found her jabbing around her vagina with a sharp object to make herself bleed. She had been doing it the entire pregnancy. The reason she gave, because she had 5 noisy children at home, needed some rest and knew we wouldn't admit her to hospital if it wasn't for a good reason. She would do it any time her being discharged home was mentioned. We ended up having to complete a perinatal mental health referral and consult with the safeguarding midwives as she was putting herself and baby at risk of serious harm. My brother was an EMT for 2 years and he told me this. People will try to use the ambulance as a means for transportation from Fulton to Oswego, because the hospital is in Oswego, by faking seizures. Sometimes when the head EMT guy was feeling fun and knew that the person was faking, he'd say something like, "Man, it's weird that he's having seizures but not peeing himself." Apparently the person would kind of snap out of it for a second, weigh up the repercussions, then either pee themselves or stop faking. I thought that was hilarious. We had a family calling for a Medicab, a cab paid for by income-based insurance, from somewhere out in the sticks to our ER in a college town, every few weeks or so. The mom would be seen for some ailment or the other, and the rest of the family would go to Walmart, go to the mall, do all their in-town errands. She was basically faking an emergency illness every few weeks so they wouldn't have to pay for a cab to get their shopping done. This patient comes in for back pain with weakness of the legs. Gets a full workup with MRI, standard blood work, and then some immunological things to look for stuff like myasthenia gravis. No neurological or immunological explanation for the weakness. Patient is seen by physical therapy and they are of the opinion that the patient is holding back intentionally. Go to see the patient at the end of the day and prep them for discharge. Patient is infuriated that they're being discharged. Yelling and screaming about how they aren't better, how they're disappointed in the institution, blah blah blah. They said one particular thing that still clearly stands out 3-4 years later. "I can't believe you're sending me home already. I haven't even told my family I'm here, and now you're going to send me home before they even have the chance to see me." My attending and I leave the room to arrange things with the nurses. We go back in and the patient is out of bed and standing up in the middle of the room. Miraculously the patient is able to walk with zero assistance when they had so much difficulty with any assistance over the previous 2 days. At that point, they were enraged. We went into the room without knocking. They were discharged home after a conversation regarding abuse of medical services. Not a doctor but worked in healthcare for nearly 20 years while taking a break from the ICU, due to it being emotionally draining. I worked in home health for a bit. I had a patient who clearly had Munchausen syndrome. On a daily basis she would call her insurance to see what things would be covered if she was diagnosed with this or that. She called her doctor's office an average of 5x during my shift with her. She would report all kinds of non-real symptoms. She pestered the doctors into do exploitive laparoscopic surgery. Of course nothing was found. One day I walked in and she was rubbing her incisions with rotten cabbage trying to get it infected. She wasn't seeking pain meds, except to sell. Really, she was just as happy with antibiotics or stool softeners. Anything, as long as they wrote her a prescription and she got to go to the pharmacy where she did a whole song and dance for them too, claiming allergies and reactions. She always increased the exaggeration of her story too. One time she fluttered her eyes, after making sure I was looking, and said she lost consciousness in that half a second. She called the doctor and claimed she lost consciousness for 5 minutes. She called the insurance and claimed it was 10 minutes. She called the pharmacy and claimed it was 30 minutes. Then she called 911 and told them she woke up on the floor after losing consciousness for 4 hours. The worst thing about her was she was a mom. Her son was 28 at the time, and by all the stories of his childhood illnesses and all her saying how he is severely disabled, I knew she basically fucked up his childhood with Munchausen by proxy. She portrayed him as being severely disabled and that's why he would never find a wife. I met him, he was healthy and of average intelligence. He wasn't looking for a wife. He was gay, but she refused to accept that. Working with her was so miserable that I took a couple years off from any and all healthcare after that. Nurse for an ophthalmologist here. Had a 21-year-old new patient claiming to be completely blind from a sudden and severe glaucoma diagnosis from a previous unknown doctor. Would feel around while walking, tried to keep eyes rolled back into his head. The whole 9 yards. He said he is a famous YouTube rapper that is now unable to make videos or earn a living. I exclaimed to have heard of him before and very excitedly asked him to search and show me his YouTube channel on my phone so that I could subscribe. He took my phone out of my hand and effortlessly found the YouTube app and typed away in the search bar. Oh, and of course his eyes were back to normal and focused. I am a nurse but not a doctor. I had a patient who worked in a hospital, janitor, so he knew enough to fake a bit. He was seeking pain meds, complaining of chest pain, wanting morphine. He was worked up for everything cardiac and was fine. Then he tried to claim GI discomfort when he was being discharged. Cleared again for everything. Fake chest pain again. Cleared again. Now he's my patient. I'm a new face. He's telling me he's having abdominal pain. I call the doctor, knowing this guy's history. He says he'll be up to see him soon. This patient wants a ginger ale, some stomach ache. I decide to go to lunch. My co-worker comes into the lunch room, disgusted. This guy had taken a dump in a basin and then dumped the ginger ale over it and tried to tell her he did fecal vomiting. He obviously needed Dilaudid right now for the pain. I walked into his room and sure enough, a pile of shit in a puddle of ginger ale. I told him I'd have to take away his food and drinks and we'd have to put an NG down. Suddenly he changed his tune. He admitted to faking it. Why do these people do what they do? In the story, Opioids posted this before, but male patient, 18 years old, rolled in unconscious. Mom says he's been like that for the past 4 hours. Go to check his lungs when I hear something interesting. I place the stethoscope near his mouth and hear him breathe in normally, but then breathe out by saying breathe. No joke. Male patient, 21 years old, admitted with inability to speak for last 2 hours and respiratory distress. Lungs clear, but we hook him up to oxygen for a few minutes. After he's taken off, his father comes running and drags me over, saying his son's tongue refuses to go back in after receiving the oxygen. I look at the kid and he's seriously just lying there with his tongue poking out like a child. I tell them to push it back in. A few hours later the dad tells me the boy is convulsing. I go to see without making my presence known and he's lying there just fine. The moment I ask the mom how he's doing, he starts convulsing. Think of an odd version of the worm, but on his back. Female patient, 16 years old, admitted with complaints of recurrent seizures and frothing from the mouth. I look at her and she is literally blowing spit bubbles. I check her reflexes, everything is intact. The moment I turn away to check on another patient, she suddenly becomes rigid and the spitting intensifies. Male patient, 30 years old, unconscious and completely unresponsive for 6 hours. This guy was totally dedicated to his act. I initially approached it as a stroke, but when the blood pressure, ECG, reflexes, pupils, etc. all are normal. I start checking pain sensation. He slowly began to open his eyes and groan as I asked him to tell me his name, but the moment his Achilles tendon was pressed, he suddenly sat up, stated his name, and declared himself cured. Female patient, 17 years old, complained of respiratory distress and convulsions. Everything's normal on admission, and she's conscious but refuses to eat. Parents are worried out of their minds, and every few minutes she has a fit where she would just basically shake from side to side. She let slip to a nurse that she didn't want to go to school that week, so she was faking an illness. Since she was refusing to eat, the attending wrote up an order for a nasogastric tube, which was inserted and then removed by her in a matter of minutes.